I think he's here. We're just going to admit. We're on. Now go to your speech.
Hello.
Hello, Dr. Slaoui. How are you?
Hi, good. How are you? I apologize. I have to call you from a car because my anyway, my arrangements have been such that I just have to stop and call you from the car.
That is not a problem. It should take us just a few minutes to go over the intro, and then we'll start the question. Is that okay with you?
Yes. And so, can you tell me how many people are attending, or who is attending?
This is a virtual event. I only have my team behind me, RITAH Foundation Team members. Because of COVID and all of that, we're just going with virtual events for now.
Yes, yes. But so you're recording it and then we'll use it, or are there people live?
Actually, we are live now.
We are live as we speak.
Yes.
Oh,
So
very good.
Hi, Moncef. How are you doing?
Very good. Salam alaikum.
Alaikum assalam. It should take me just a few minutes to go over the intro and we'll start.
Very good. Thank you.
Thank
and
you.
I have 15 minutes, right? Thank you. I must be done at 7:15. Thank you.
Okay, perfect. So hello, everyone. My name is Mariam Taher Zakari, the president of RITAH Foundation. On behalf of my team members taking an important part in tonight's event, as usual, I would like to thank you all for joining us tonight as we live stream our first event for 2021 to answer all questions about corona vaccine. Now, in order to provide a safe environment for all, we have all been tested for COVID-19 and Dr. Zakari is already vaccinated. Now, tonight we have two important guest speakers joining us live. Our first guest is the Chief Science Advisor for the US vaccines efforts, known as Operation Warp Speed, Dr. Moncef Slaoui. And we will start with him exactly at 6 o'clock. At 7 o'clock. Our second guest speaker is the Chairman of Infectious Diseases at Advent Health, Dr. Juan DeJesus Diaz. Now, before we start with the questions, we want to encourage you to keep sending your questions, preferably in the comment section, as it is easy to track, or you can proceed with a private message at RITAH Foundation's Facebook page. We have gathered all your questions, but keep them coming. I have my team behind me here keeping track of all of that, and we will promise you that your questions will be asked anonymously. Just a quick recap before we proceed. RITAH Foundation is a non-for-profit foundation. The main inspiration behind the name is my late grandmother, Rita. May she rest in peace. RITAH Foundation also stands for Resources for Integrated and Transitioned Arab Healthcare. That is one of our main goals, is to raise awareness and to thrive in the fight against preventive diseases. Now, accordingly, and since the inception of our foundation, and thanks to each one of my team members and to all your ongoing moral support, we have conducted events with thought leaders in the medical field to bring attention and address issues pertaining to different tumor sites, including breast and colorectal cancer. Last year, we focused on COVID-19's initiative. For instance, in Ramadan of 2020, RITAH Foundation donated basic groceries to 37 Moroccan families dealing with day-to-day hardships and living in the countryside of Morocco. Now, for more details and to follow our previous and upcoming efforts, as we are committed to addressing more topics in the future and delivering more events that will help our community, please like and share our Facebook and Instagram page. Now, with that said, in the midst of this pandemic, we hope that you and your families are doing well. And for everyone who lost a loved one, words cannot even begin to express our sorrow. For sometimes this tragedy will focus almost all our attention. We are just hoping that we are able to put this tragedy behind us. Now it is 7 o'clock and we have the Chief Science, perfect timing, right?
Yes.
We have the Chief Science Advisor for the US vaccines efforts, known as Operation Warp Speed, joining us tonight. Dr. Moncef Slaoui, thank you again. Now, before proceeding with questions, my team and I want to let you know that we are very proud of your success. We are grateful for your achievements while leading Operation Warp Speed. And we are honored to watch someone from a Moroccan background like us, be an important pillar in this patriotic act against the COVID pandemic. So thank you again. So we'll start.
Thank you for having me. I didn't know about your foundation. I just now learned about it. I just want to congratulate you for what you're doing. I find that really remarkable, and I'm really glad to be able to talk to you and the people who are part of the foundation and are listening. Hopefully it will be interesting, and congratulations. I'm really impressed. Well done.
Thank you so much. Coming from you, it means a lot to us. I will start with the first question because we know your time is very limited. So your role is to discover and develop the vaccine. You have exceptionally fulfilled it in a promptly manner. So Dr. Slaoui, are you satisfied with the strategy that you put forward and the outcome? And what are some of the barriers that you have encountered for the vaccine to reach more people?
Well, I mean, discovering and developing the vaccine, that piece of it has gone, frankly, very well. And as you know, we've been able to enable and accelerate development of 2 vaccines that have been now approved, the Pfizer vaccine and the Moderna vaccine, in a matter of, in fact, 11 months, since today is actually the unfortunate anniversary of the first case described in the US. So that is exceptionally fast. We've been also able to accelerate the manufacturing of the vaccine. Up to now, about 45 million doses of vaccine have been manufactured and shipped. Where we have not performed as we hoped is how many people are immunized, in that only about maybe 6 million people today have been immunized. So we could do much better than that, and I hope with the new administration help, we'll be able to do more. I mean, the impediments, frankly, have been very few in terms of discovering and developing. It's been an incredible partnership between US government agencies, academia, the private industry, and the army. And together we've worked, frankly, day and night with no interference, with every resource that we needed. Ultimately we have 2 vaccines approved, and there will be a 3rd one coming up most likely within the next 10 days, probably, the Johnson & Johnson vaccine. So really good achievements, but unfortunately not enough immunizations given to people, and we need to accelerate that.
That is amazing and exceptionally done in a short period of time, which leads us to the next question. What would you tell people who are still apprehensive about taking the vaccine? We have an example of a concern that stated as follows: how come we are still looking for a cure for certain diseases like cancer, and it took a short period of time to come up with a vaccine to fight a deadly virus? Or in other words, what would you say to undermine their hesitancy?
So hesitancy is, of course, a very important concern, and unfortunately has been in part amplified by the politicization of the whole process since this whole thing happened during the elections, etc. Now, I understand that people should be asking questions and making sure that the vaccine is safe and efficacious. What I can tell people is, when you ask questions, please do not assume the answer. Please open your ears and your mind and be receptive to listening to the answer, which is anchored in data and in science. The process here in the US is a very transparent process. The FDA has held an advisory committee with these vaccines that was streamed live on internet. Everybody in the world could see it, where the data have been discussed in detail. Thousands of experts across the globe have been able to also see these data and have a view on them. I'm talking about real scientific experts, right? And the data are compelling. The vaccine is 95% effective. It's in effect an insurance against this disease. And it's very safe. It's as safe as all other vaccines that are currently approved and in use in millions and millions of people. So please keep your mind open, look at the data, talk to experts who are scientific experts, not, frankly, people who pretend to be an expert. And if you do so, you will be convinced. Talk to people who received the vaccines. They will tell you the kind of side effects they have had. And also remember, the vaccine gives you certainty to protect against the disease. The disease is the risk you know. The vaccine has no risk. Secondly, you will not only protect yourself by being vaccinated, you will protect the people that you love, that are close to you, your parents, your grandparents, your children. And that's also very important. If you don't get yourself vaccinated, not only you may harm yourself, but as importantly, you may be harming people around you.
Thank you, Dr. Slaoui. I mean, we have Dr. Zakari with us tonight. He got both doses of his vaccine. He's doing well. We encourage people to get vaccinated, as you have mentioned. So you did mention 95%, and the question that we have: once vaccinated, does the published data show guaranteed immunity to the virus? Or and my second question related to that: can the vaccinated person still spread or shed the virus?
So the vaccine efficacy that's been described is efficacy against disease. So when you're vaccinated, you have 95% efficacy against disease, which is almost certainty. It's not 100%, it's 95%. So you have a very, very, very small chance of still being infected. And in fact, efficacy is 100% against severe disease. So you will not have severe disease, and therefore you will not have deaths. You may have a cold-like symptoms. Now, whether the vaccine protects against transmission or not, we don't know. We are studying that as we speak. Those are much more complex studies because, as you know, transmission happens when people have no symptoms. And 9 out of 10 people who are infected with this virus never have any symptoms. So it takes a lot of analysis of samples on a daily basis to be able to assess whether a vaccine is effective against shedding of the virus. And we don't know yet. We may know maybe in the spring. These data will become available.
Very good. And is the incomplete immunity or half dose as risky as no immunity?
No. However, I think the vaccine should be used as approved, which should be 2 doses of vaccine, either 21 days or 28 days apart, depending if the Pfizer vaccine or the Moderna vaccine. The vaccine that's coming up, the Johnson & Johnson vaccine, which is a very different technology, also, I hope will be very effective. We'll know this before the end of this month, January. That will be a 1-dose vaccine, just 1 shot. But otherwise, the currently approved vaccines have to take 2 doses. And I really recommend that people take the 2 doses. If you only take 1 dose, you will not be optimally vaccinated.
Very good. That answers that for sure. Now, the new version of COVID is now reaching the US. Would the vaccine control this most infectious strain of the virus as well?
Yes. So first, it's totally normal for this kind of virus called RNA viruses to mutate. That's totally normal. It's also expected that normally the virus that spread more effectively are usually less symptomatic, because that's why they spread more. It's because they don't make people too ill. You know, viruses don't jump on their own. They need a person to be in contact with another. If you're ill with the virus, you're less likely to transmit. If you're asymptomatic, you're more likely to transmit. So on average, viruses that are more contagious are actually less harmful. But having said that, just to kind of calm people that this is not something that's unexpected. Up to now, the virus from the UK and the virus from South Africa, those are the 2 variants that are most talked about, are protected against, are neutralized by the antibodies made against the vaccine. So it is expected that the vaccine is effective against them. Someday there may be a virus that escapes the vaccine. If that was to be the case, we now know that we can make vaccines very quickly, even faster than we've done up to now, because we know more specifically how to produce them. And with the NIH and the CDC, we're working on a surveillance system that will very quickly detect if and when a virus escapes immunity from the vaccine to be able to start making a new vaccine against a new virus. I don't expect that to happen at all. And if it was to happen, it would probably take a long time before this happens. Years.
Okay. Now, you mentioned that, you know, they're working on a third vaccine, but for now, what would you say is the difference between Pfizer and Moderna?
There is no difference on safety and no difference on efficacy. There's a difference in the temperature at which they have to be stored, but that doesn't impact at all the you know, people who are vaccinated. In terms of the people who are vaccinated, there's no difference. Either vaccine is outstanding, frankly.
Very good, very good. That's very good to know. Now, how soon would you say we should feel safe again, or at least see the level of mortality and morbidity significantly diminishing?
So, you know, we're working hard to improve the levels of immunization, as I said. I think once we will have immunized most of the elderly people, people over the age of 75, you know, that 80% of deaths in the US are in people who are over the age of 70. So if once we immunize people who are older and immunize people who are the first line healthcare workers and the first line workers, that's about 100 million people. And everybody agrees that is gonna be achieved somewhere between the end of the month of March and the end of the month of April. Most of the morbidity and mortality associated with this virus will go away. There may still be virus circulating because we will have only vaccinated about a third of the US population. We need to have immunized about 70 to 80% of the population for the virus to decrease circulation and for the pandemic to effectively be under control. That may be achieved probably in the summer, in June or July. But already, I hope, as of the month of April, we will have much less mortality and much less people in hospitals.
Hopefully, hopefully. I am going to conclude with the last question. When they ask the main Super Bowl players after a big win, what are you up to next? They say, I'm taking the kids to Disney. So what is next for you?
Well, first of all, I would like to have some rest. It's been 8 months where I've been working 24 hours a day. I've been away from my family. My family lives in Philadelphia and I've been in Washington, DC in a hotel room. So I would like to come back and be with my family and my children and my wife. And, you know, before taking on this role, I was a board member in a number of biotechnology companies, working on vaccines, but also working on medicines like cancer and other chronic diseases. I will go back to that, to being an investor and a board member in a number of biotechnology companies with always the same objective, which is to help people live longer and be better, either through medicines or through vaccines and prevention.
I know, I mean, like you said, you definitely need to take time to rest and spend time with the family. We hope we get to see you in Orlando soon. But I just received the one question, as we have 1 minute left with you. A lot of people are asking about Moroccan vaccine. Do you have info on that?
Well, my information comes mostly from my family who is living in Morocco. And, you know, apparently there was a plan that there would be the Chinese vaccine in Morocco, used in Morocco as of middle of December or early January, and there's nothing yet. The Chinese vaccine is not well described, frankly, in the scientific literature. Most recently, the Brazilian government has announced that it's only 50% effective, rather than 90%, as was claimed by the Chinese company that makes it. So I don't know, but I understand that there's no vaccination yet. Now, having said that, a 50% vaccine is much better than no vaccine. So I would recommend people to look at the safety data with the vaccine. I know the technology they used, and it's a technology that's very well known and used for a number of other vaccines that have been around for decades. I don't think it's a dangerous technology at all. So I don't know the data again, so one needs to be careful. But at first glance, I think it should be an okay vaccine, even if it's only 50% effective.
Dr. Moncef Slaoui, thank you so much. We appreciate your time and the valuable information you shared with us. Enjoy the rest of your night and drive safe.
Thank you very much, and I apologize. I had to be in my car, but I was stuck somewhere and I couldn't be back at home. So thank you very much. And again, congratulations for your foundation. I really applaud you on that. Thank you very much. Shukran.
Thank you. La shukra ala wajib. Thank you so much. Thank you.
Bye-bye.
Bye-bye. All right, for everyone following us live, Iman is one of RITAH Foundation team members attending mid-school. She's eager and ready to moderate the rest of the live while we are monitoring the audience's questions and concerns about the corona vaccine. Iman, thank you so much, and the floor is yours.
Can you hear me?
Yes, we can hear you, Dr. Diaz.
Oh, I got scared. I couldn't get in, and I said, I hope these guys can hear me and know that I'm locked out.
Well, we have you now. Thank you so much for joining us, Dr. Diaz. Thank you to Mariam and Dr. Slaoui for that very informative presentation. Good evening to everybody that's watching. Thank you for joining us. I'm so pleased to introduce our next guest speaker, Dr. Juan DeJesus Diaz, Chairman of Infectious Disease at Advent Health. Dr. Diaz completed his internship, residency, and fellowship in infectious disease at the University of South Florida of Medicine in Tampa, Florida. Dr. Diaz is a board certified in internal medicine and infectious disease by the American Board of Medicine. He has also completed specialized training in hyperbaric medicine and wound care. Dr. Diaz has over 19 years of experience, and we are honored to have him speak today on this chapter. So Dr. Diaz, thank you for joining us, and the floor is yours.
Thank you for that warm reception. Welcome to the program, everyone. And our topic is COVID vaccination. And my hopes tonight are just to dispel either myths and give you the appropriate information that will help with some vaccine confidence by the time that I'm completed here this evening on this brief lecture. So let's go ahead and get started. Next slide. So a little bit of background. What exactly is the SARS-CoV-2? And it's the person-to-person transmission, which causes severe acute respiratory syndrome, and it's caused by coronavirus 2. It's mainly through droplet, respiratory droplet, similar to influenza, and that's why everyone has been wearing these masks. Another common question is, how long is the incubation? In other words, what is the time frame from the time that you first get exposed until you start showing symptoms? And the typical incubation can go as long as 14 days from exposure. However, most cases fall between 4 to 5 days of your exposure. The overall case fatality is estimated to be between 2 and 3%. However, that can vary according to age and comorbidities. So in other words, someone who's 18 years of age with no risk factors, that estimate is likely to be lower in comparison to someone who's 75 years old with hypertension and diabetes. Perhaps that number could be higher than 3%. As of this week, there's already been 403,000 deaths in the United States. Next slide. So what are these risk factors that we're talking about? Who are these patients that have high risk? So severe illness can occur in any otherwise healthy individual, but age and other risk factors are the main things that contribute to the severity of illness and the mortality or the death rate. So if you look at cardiovascular disease, let's say someone that has a history of congestive heart failure, a person that has diabetes mellitus, hypertension, chronic lung disease such as COPD, underlying cancer, chronic kidney disease, or patients that are obese, typically with a body mass index of greater than 30. If you're a smoker, if your age is greater than 65, or age greater than 55, who has some of the diseases that we just discussed above, specifically cardiovascular disease and or hypertension, or the chronic obstructive pulmonary disease such as emphysema or asthma. Next slide. So let's talk a little bit about immunity and then the vaccination. So one of the common questions that we get asked is, does protective immunity develop after having COVID-19 infection? And can there be reinfection? So antibodies to the virus are induced when you become infected. Some of the early evidence suggests that some of these antibodies are protective. And the number right now being tossed around is roughly 90 days of protectivity, okay? However, this remains to not be completely established at this time. This is a new and ongoing, and we're learning as we go with this pandemic. So it is unknown whether all infected patients will mount a protective immune response and how long that protective effect will last. In other words, if someone had disease and all they had was very minor symptoms and never became hospitalized versus someone that was admitted to the hospital and was severely ill and ended up in the intensive care unit, perhaps on mechanical ventilation, the latter patients may be more apt to mount a response because they had more severe disease. So this is just a trend. It's not a set in stone. And there are rare cases of probable reinfection that have been reported, and most of those patients have landed after that 90-day period. So what about the vaccines? What can we do about what we have right now? So there's 2 vaccines currently available, and we have results from 2 placebo-controlled phase 3 trials that have been reported. Now, one of the common myths that says, well, steps were skipped in order to get approval from the FDA. Well, the vaccines are currently under the emergency authorization use. There was no steps that were skipped. Phase 1, phase 2, and phase 3 trials were all conducted together simultaneously, and in order for it to be to come to fruition faster, but no steps were skipped. Both of the vaccinations are what we call messenger RNA vaccination. One is a company that teamed up with Pfizer called BioNTech, and the other one was another company called Moderna. Both vaccines had essentially 95% efficacy in preventing symptomatic COVID-19 infection. With the Pfizer vaccination, roughly 7 days after the second dose that you receive, you should have adequate antibodies. With the Moderna vaccination, roughly 2 weeks after your second vaccination, you should have adequate antibodies. And we'll discuss this a little bit shortly here. Vaccines to prevent COVID-19 are the cornerstone in order to wrap this up and have some type of control over the pandemic. Next slide. So who is currently available to receive the vaccination? Next slide. So as we see here, this is adopted from the Center for Disease Control, and anyone can go on cdc.gov and look for this for yourself if you have additional questions beyond the scope of our lecture this evening. But this is the very first slide here showing who the CDC recommends that should undergo vaccination for COVID-19. So the first phase was termed A, B, and C. And A is healthcare personnel and long-term care facility residents, which the majority of those have already completed. We've already been through a phase 1A. Phase 1B, which we're currently in as well, is the frontline essential workers. And I have a slide coming up just exactly who those people are, and patients that are 75 years of age and older. Phase 1C, which we're also in right now, is patients that are age 65 through 74 and people that are age 16 through 64 who have those underlying medical conditions that we just talked about that places them at higher risk, such as diabetics, chronic kidney disease, etc. Next slide. Here's a brief overview taken from the National Academies of Science, Engineering, and Medicine, showing you the approach from phase 1 all the way through phase 4. We just discussed phase 1. Phase 2 will be rolled out to teachers that teach from kindergarten through 12th grade, school staff, and childcare workers, and then also critical workers that are in high risk settings, and also people of all ages with comorbid underlying conditions that places them at moderate higher risk, as opposed to those phases in phase B and phase C. As you can see, as we shift to the right, phase 3 would be all young adults, children, and I'm going to say that with an asterisk because at this time there is no indication for vaccination of children, and I have some slides coming up to discuss this shortly. And then phase 4 would be everyone residing in the United States that has not received access to the vaccination in the previous phases. Next slide. Now let's talk about who exactly are those frontline workers. The frontline workers are essential workers that are important to our society. They work in sectors that are vital to the functioning of us operating day to day. So for example, a grocery store worker, a banking, things of that nature, postal office, postal workers, those are the type of frontline essential workers that are considered. Next slide. This slide is somewhat busy. Again, it's also adapted from the vaccine working group, from the ACIP. And this is showing you again the phase 1A, 1B, and 1C. And you can see there under 1C, some of these essential workers, it can expand on what I just gave you. So beyond the examples I gave you, you can also put in there energy jobs, legal jobs, food services, shelter and housing, just to name a few. And to the right, you can see what the estimated number of unique individuals in each one of these groups and where they land. Just to show you that there's over 30 million individuals in that frontline essential workers. And then you can see that individuals ages 65 to 74 that need the vaccination are approximately 28 million individuals. Next slide. Okay, so how's the vaccine given? So these are both messenger RNA vaccinations that consist of 2 doses that are administered intramuscular. The first vaccination is the Pfizer and BioNTech, and you give it at day 0, and then 3 weeks later, you have your second dose. The Moderna vaccination is given at day 0, and then 4 weeks later to complete the series. So persons should not be scheduled to receive the second dose earlier than the recommended dose. For example, 3 weeks with the Pfizer and 4 weeks with the Moderna. However, the second dose may be administered early within a grace period of up to 4 days earlier if that's all you have access to in front of you. Next slide. So how about vaccine safety? What are some of the common side effects? They include injection site reaction or pain, fatigue, headache, muscle aches and pains, chills, joint pain, and fever. These are the most common side effects that most individuals will receive. And it's just your body mounting a response so that when you do see the virus, you're able to be protected. Another common question is, what if I'm pregnant or breastfeeding? So at this time, no patients in the trial that were enrolled were pregnant or were breastfeeding. There's no safety data for COVID-19 vaccinations at this time in lactating patients or patients that are for being breastfed for infants. They're not thought to be a risk for breastfeeding infants, and the lactating person is part of a group that's recommended. For example, say your healthcare personnel may choose to be vaccinated. So ultimately, it's all risk versus benefit for those particular individuals. Next slide. How about immunocompromised hosts? So a few things. So patients that had HIV infection were enrolled in some of these trials. I don't know off the top of my head how sick were they? Did they have HIV and AIDS? Did they have a very low T cell count? Or were they just HIV non-AIDS patients? But some of those patients were in the trial, as well as other immunocompromising conditions. However, these patients were not studied rigorously. So at this time, it's all risk versus benefit. And these patients are at high risk for having adverse outcomes and increased mortality from COVID-19. So I can tell you just from my personal experience that my patients that fall into this group, the benefits outweigh the risk. And the main question would probably be is whether they're going to be able to mount an adequate response. However, but again, these patients were not studied. And that's the moral of the story here, that it's all risk versus benefit. And that's the counseling that we should be providing to our patients. Next slide. Again, special populations. So commonly, people will ask me, well, I have rheumatoid arthritis, or I have systemic lupus erythematosus. I have an autoimmune condition. Can I take the vaccination? And there was no patients that were enrolled that had these autoimmune conditions, to my knowledge, or a significant proportion of them. So again, this is all risk versus benefit, and these patients do have higher risk if there are other medications that suppresses their immune system, and therefore that they should discuss it with their healthcare provider. Another common question is, what about patients that have a history of Guillain-Barré syndrome with other vaccinations? So if a patient has had previously had an episode of Guillain-Barré, they may receive the 2 COVID-19 vaccinations that are currently available. To date, there has been no reported cases of patients that have had Guillain-Barré with COVID-19 vaccination. How about Bell's palsy? There were a few patients that had Bell's palsy in the COVID-19 vaccination trials. However, the rate of patients having Bell's palsy after a COVID-19 vaccination does not have any difference in what the general rate of having Bell's palsy in the general population that did not receive the vaccination. So therefore, it is not a contraindication to you not be able to be vaccinated just because you've had a history of Bell's palsy. Next slide. So what are some other possible side effects? We alluded to the first one already. To this moment, over 1.8 million patients have already received their first dose of the Pfizer, BioNTech, and Moderna vaccination. Out of the 1.8 million, 21 have had adverse reaction considered anaphylaxis. And anaphylaxis is when your blood pressure may go lower. You may have some wheezing, some respiratory distress. Your lips can swell up, and also you may have a rash. Out of those 21 patients, out of the 1.8 million that have been vaccinated, they all recovered and there was no deaths. Next slide. So what are some absolute contraindications? So these are the ones really that we really want to hone in on. These are the ones that you cannot have the vaccination. And as you can see, it's probably a minority of patients simply because mRNA vaccinations are not that common. So the CDC considers a history of having any of the following 3 side effects or previous reactions to be an absolute contraindication. So if you've ever had a severe allergic reaction, for example, the anaphylaxis I just discussed, to a previous mRNA vaccination or a previous COVID vaccination with the first dose or any of its components, you should not be retried. If you've had immediate allergic reaction of any severity to a previous mRNA vaccination, or if it had components of the polyethylene glycol or the PEG, the key ingredient there is the PEG, then that's considered an absolute contraindication. And last but not least, if you've had an immediate allergic reaction of any severity to the polysorbate, and the polysorbate can have potential cross-reactivity and hypersensitivity with the PEG or the polyethylene glycol that I just discussed. Now, what exactly is polysorbate? Those are emulsifiers that they use in cosmetics to solubilize water-based products. So patients may even have had a history, say, I once took this cosmetic and I had a severe allergic reaction where my throat closed up. And that would be something to think about, that you should not receive the vaccination. Again, these are a minority of patients, and very, very specifically, this is the red box that I want you to memorize. But if you don't fall in this red box, then we should proceed. Next slide. Is the vaccine 100% effective? And will I be guaranteed I will not get COVID-19 if I receive the vaccine? So the answer is the efficacy is 95% for both currently available vaccines. And of course not. Nothing in medicine is ever 100%, and nothing is ever guaranteed. You could theoretically still become infected. However, your chances are greatly decreased by you being vaccinated. Next slide. Next question is, what can I do right now to protect myself until I'm eligible to receive the vaccination? So I would encourage everyone to do what we're doing now, is wear masks, social distancing, wash your hands, avoid touching your eyes and your mouth with your hands, avoid large gatherings outside of your quarantine team, as I call it, avoid high-risk areas such as gyms and bars. And those would be some of the examples that you could do right now and continue doing it until you're able to receive the vaccination. That being said, after you receive your vaccination, the current CDC guidelines still support that you should still be wearing your masks for protection. Next slide. I heard there's 2 different kinds of vaccinations. How do I know which one to get, which one is best, and which one is safest? So you will know at the time of vaccination which type of vaccination you will receive. The most likely scenario is that you probably will not get to choose what type of product you get because it's the center that you go to and it's what they have on hand. However, that can change, and there may be centers that give you the option, but to my knowledge, I do not know of any center that's giving you the option. No one vaccination is superior to the other with regards to efficacy or safety. So they're interchangeable for now. Next slide. So what are some of the components of the vaccine that we talked about earlier? There's essentially 3 main components to both vaccinations. There's the backbone of the vaccination called the messenger RNA component, which is what decodes inside the cells in order for you to mount a response towards that viral spike protein. And that's really the vision on where it gets you your antibody response. The second component is a packaging component, which is the lipids, which has the cholesterol component, and it may have the component of that glycerol that we talked about. If you ever had an allergic reaction with anaphylaxis, you should not be rechallenged. And then the last component are simple salts and sugars and buffers for the vaccination to be kept at bay. Now, I do want to discuss that neither of these vaccinations contain eggs, gelatin, latex, or other preservatives, which have previously been issues. I've had issues with allergies and allergic reactions in other vaccinations. Next slide. Next question is, will I feel sick after the vaccine like some people do after the flu shot? The answer is you can. I know many persons and individuals that have received the vaccination that had absolutely zero reaction, not even as much as a low-grade temperature or body aches. However, there is a significant amount of patients that will have local reaction and systemic adverse reactions with the pain, the body aches, the fever, the fatigue, and the headache. And those are common. They're typically non-severe, and they usually go away within 24 to 48 hours in most individuals. Next slide. Next question is, can my child get the vaccine? The answer for right now is that children and adolescents outside of the authorized age groups, which is 16 years of age and older for the Pfizer-BioNTech and 18 years of age and older for the Moderna, these patients should not receive the COVID vaccination at this time. Next slide. So here's your next question. We're almost at the end here, everyone, so hang tight. Are there other vaccines I can get that will protect me from COVID-19 infection? And will the flu vaccination prevent me from getting COVID-19? The answer is no. The COVID-19 vaccination is specifically for COVID-19, and the flu vaccination will not offer any protective advantage for COVID-19 infection. Next slide. I've already had COVID-19 infection. Do I still need the vaccine? So the clinical trials show that the COVID-19 vaccine is safe in persons that have had previous infection with COVID-19, whether you were symptomatic or asymptomatic. So even if you were one of those individuals that never got sick and you were shedding, but you had your antibodies tested in the past, you should receive the vaccination. Vaccination should be offered in all of these patients, regardless of your previous infection with COVID-19. The current data also notes that reinfection is uncommon within that 90-day span of you being sick. So if you've had infection within 90 days and you want to hold off until day 91 to delay the vaccination until the end of that period, that is perfectly acceptable. Next slide. Okay, that's my last slide with regards to the questions that I had. I think I'll open it up to any questions that you guys may have now for me from the audience, if that's a possibility.
Great. Thank you so much, Dr. Diaz, for that comprehensive presentation. We really appreciate it. And thank you again for being so flexible and asking for our questions beforehand. That way you could tailor your presentation. I know a lot of the questions that we got, you pretty much answered in your presentation, but we're going to move on to some questions that were just given right now while you were talking. The first one is, Can people with graft versus host disease, GVHD, after a bone marrow transplant receive the vaccine?
Okay, fantastic question. It's a yes and no answer. So here's the two examples. The short answer is yes and no. So the first example I'd like to give is someone is within the 100 days of undergoing transplantation. We generally do not vaccinate those patients because they're just unlikely to respond and mount a response. In other words, so you'd be giving them a risk without much benefit. Also, if you're within that 100-day period or after the 100-day period, receiving intense immunosuppression for graft versus host disease, you're unlikely to respond to the vaccination as well because you're receiving advanced and intense immunosuppression. So you'd be at a portion, at a component there where the risk outweigh the benefit. However, if you're past the 100 days and you had chronic graft versus host disease as opposed to acute graft versus host disease, I would say that that's a patient population that I may offer it to because they've had it for quite some time and they're not on the intense immunosuppression that they once were, and they're outside of the 100-day window. And I think there would be a decision between the oncologist and the bone marrow transplant team in conjunction with me and also the patient. And I think that would be a risk versus benefit. And I personally would say that I think that the benefits would outweigh the risk in that situation.
Okay, thank you. The next question, can someone donate convalescent plasma after getting the COVID-19 vaccine?
Good question. The answer is probably yes, but I do not know for sure.
Okay, thank you. Next question is, I have severe rheumatoid arthritis and I'm allergic to most medications. Should I receive the vaccine?
The answer is, as long as you don't meet any of those 3 contraindications, you should be perfectly fine to go have the vaccination. In fact, you're one of those patients that falls into the higher risk of having adverse outcomes and complications from COVID-19. So yes, you should be able to be okay to have the vaccination.
Okay, great. And can children under 5 receive the vaccine? I know you maybe touched on this on your presentation, but if you could just elaborate.
At this time, children were not studied and they were not included in the trial. And according to the CDC, children are not going to be offered the vaccination at this time, where we're still in late phase 1, perhaps entering phase 2 here soon. But at this time, they're not being offered for children.
Okay. And the next question is, will the vaccine be obligatory into travel in the future?
Great question. So there are some vaccines that are currently obligated. An example that would be the yellow fever vaccination to enter certain countries. To my knowledge, there is nothing that's being done at this time to say that you have to have it. But stay tuned. Remember, this is all on-the-job training. It's work in progress, and we're all learning as we go with everything that's occurring during this pandemic. So I'm sure that there will be some further information to come forward from the new administration discussing the current vaccination status.
Okay, great. Thank you so much. I think we covered all the questions that were, actually, we're having some questions come in right now. Let me see. What effect will the vaccine have on people with low immune system?
So that's a very, very ambiguous question. It's somewhat difficult to say because immunosuppression, a low immune system, it varies very widely. So one can say a patient with HIV, but they don't have AIDS, that's considered a low immune system, but they were actually, some of those patients were enrolled in the trial and they responded. Conversely, I could say someone just completed a bone marrow transplantation 2 weeks ago, and they're very low immune system, even lower than the HIV patient, and they're unlikely to respond to any vaccinations, period. Okay. So it's a pendulum, and it all depends on where you fall into that pendulum of net immunosuppression to the far right or the far left.
Okay, and I think we just had one more question come in. What is the grace period? Can a patient get the vaccine after an IV treatment?
After an IV treatment of what?
I don't think they specified. We'll give them a moment if they're still online on the live, if they can specify what IV treatment was received. IV antibodies.
Oh, if you received the IV antibody. So I would use, so that if you receive the IV antibody, it tells me that you had COVID-19 infection and you're technically protected for approximately 90 days. So I would wait till after the 90-day period and then resume and start your vaccination series.
Okay.
Should we worry about the shortage of vaccine?
Should we be worried about the shortage of the vaccine in the next upcoming weeks?
No, actually with the new administration, it sounds like they're going to go ahead and go for the 100 days. And I think that now I just heard this morning that Amazon has just partnered with the new administration and helping with vaccine distribution. I am very optimistic that things are going to be even wider distributed. And I do not anticipate that we'll have an issue with vaccine shortage.
That's great. Thank you for that news. Do we have any more questions that anybody sent in? Okay, so I think that was the last questions that we have so far. Like I said, thank you so much, Dr. Diaz. Thank you for answering all those questions. And to anybody that's going to post a question later on the video, we'll be diligent and keep a look on it and see if we can answer your questions. Please remember that this video will be posted on our Facebook page and our YouTube channel, so you can go back and refer to it, and please share it with your family and friends. Thank you. I'm going to give the floor to Mariam, our president, and she's going to close out the meeting. Thank you so much.
All right. Thank you, Dr. Diaz. We really appreciate your time. Your presentation was amazing. Answered most of the questions, so that was great. And I'm glad that we got more questions towards the end. So thank you so much, and have a good night. Now, thank you. As we follow the news, our U.S. government is committed to deliver the vaccine to all Americans. In his speech, our new president, Biden promised that 100 million people will be vaccinated in his first 100 days in office. We are asked to mask up. Therefore, we encourage you to participate in the 100-day mask challenge put forward by President Biden. Now, our president promised a plan that is bold and effective for the vaccine to reach more Americans, and we are looking forward to the continuation of this patriotic act. To register and to schedule your vaccine in Florida, visit CDR Health Pro at www.patientportalfl.com. Again, it's www.patientportalfl.com. We checked this morning, and as of today, it is open to Florida residents only. Don't hesitate to call them and double check at 844-770-8548. Again, it's 844-770-8548. So that way you can get updates and check to when you will be open for families visiting from abroad. As we know, a lot of us, we have families visiting, and we got a few people concerned about that this morning. We will also be posting this information in RITAH Foundation Facebook page. If you like our mission and you are pleased with the content, my team and I will appreciate if you share tonight's event with others to benefit from the valuable information shared by our respected guest speakers. Also, we will appreciate if you invite family members and friends to like our page to benefit from healthcare information and updates from past and future initiatives led by RITAH Foundation. Thank you all. My team, do you have anything you want to add? Great job, everyone.
Stay safe.
Thank you, and good night.